Uh, let's just review this Uyghur cycle. This is like the map in cardiology. Ito yung kailangang memorize namin. Every exam, pag mag-cardiology kayo, may palaging bonus points, 5 points. You will draw this Uyghur cycle. Okay? So, dati in-explain ko to pero hindi ko lahat in-explain because kailangan siyang dahan-dahan lang. So the Uyghur cycle is just systole and diastole. That's the two phases of cardiac cycle. Systole is contraction, diastole is relaxation. So if you look at the Uyghur cycles, there are parameters here: phonocardiogram, electrocardiogram, ventricular volume, ventricular pressure, atrial and aortic pressure. So it start tayo sa phonocardiogram. There's that device na para siyang microphone, ilalagay mo siya sa chest, and then mare-record niya yung sound. So the first heart sound is heard during this phase. Papunta ka sa systole or end diastole, which is the time when the mitral and tricuspid valve closes. Sinabi ko na yun before. Second heart sound is because of the closure of the aortic and pulmonic valve. Third heart sound is pathologic. Dapat hindi mo siya maririnig. Meaning during rapid inflow, yung flow of blood from left atrium to the left ventricle when the mitral valve opens, dapat hindi yun maririnig. But in patients, for example, na may heart failure, sobrang dami ng blood in the left atrium and then there will be turbulence, and minsan naririnig yun as a third heart sound. And the fourth heart sound is also pathologic. This is at the phase of atrial systole or contraction of the atrium. Hindi dapat yun naririnig, but for some reason, if the contraction of the atrium is strong, then maririnig mo siya. So ECG, na-discuss na natin to, it precedes mechanical contraction or phase. So, for example, the P wave should appear first before the actual atrial contraction, and the QRS complex should appear first before the actual ventricular contraction, and the T wave is produced before the actual relaxation of the ventricles. So nauuna siya. In terms of the volume, during end systole, meaning patapos na, whatever is the amount of volume inside the left or right ventricle, that's the end systolic volume. It's about 50 ml. So the lowest volume is end systole. Now, the isovolumic relaxation, although same din naman yung volume nun sa end systole, pero the purpose of isovolumic relaxation kasi is a decrease in pressure without a change in volume. Yun yung purpose niya. So during the diastole, we have discussed this four-phase isovolumic relaxation, rapid inflow, diastasis, atrial systole. So as you can see in the graph, the volume increases in the LV during rapid inflow. About 80% of blood tumataas, or from left atrium, 80% of the blood is delivered to the LV during rapid inflow, and about 5% during diastasis, and this further increases during atrial systole, about 10 to 15% of blood. So at end diastole, whatever is the amount of volume in the LV, that's the end diastolic volume. It's approximately 120 to 130 ml. And then this will decline back to 50 ml, approximately 50 ml at end systole, kasi during systole, lalabas yung dugo, i-eject yan to the aorta, kaya bumababa yung volume. Now, ventricular pressure is just increased and decreased. Tataas lang siya from let's say 5 millimeters mercury up to 100. Pag umabot na siya sa, let's say, 85, as long as the pressure in the LV is higher than the aortic pressure, that is enough to push the aortic valve to open so that blood will go out into the aorta. So it will be maintained. It can go as high as 120 millimeters mercury, and then eventually it will drop, and then it will decline farther back to less than 5 millimeters mercury during isovolumic relaxation. So it just increases. Wait lang po, tumatawag lang si Doc. Okay, sorry. Naririnig niyo ba ako? Okay ba yung audio?
Yes po, Doc.
Medyo may maingay lang sa yung computer. But anyway, that's ventricular pressure. We also have this atrial pressure. Medyo mahirap to sa level niyo, but I need you to memorize the E wave, C wave, and V wave, and bakit sila merong ganun. So if you put a catheter on the right or left atrium, and then you measure the pressure there, there are three elevations. Yung A first is A, which stands for atrial contraction. And there is an increase in pressure inside the right atrium because of contraction of the right atrium. Second, yung C wave, and this is at during systole, because when the LV contracts, yung pressure, it will push the mitral valve to the left atrium. Parang nagbo-bulge yung mitral valve or tricuspid valve into the atrium, atrial side. So it will somehow a little bit increase that pressure. And we call that C wave. Actually, C wave siya parang tricuspid. Parang ganun, sa tricuspid, sa C ng tricuspid. Because the tricuspid valve bulges into the right atrium and the mitral valve bulges in, tama ba? Into the left atrium. Now, yung V wave naman is during systole kasi the blood is draining from the pulmonary veins into the left atrium. So there will be an increase in pressure there, and that's C wave. Okay? Aortic pressure is ang importante dito is yung crossover. Okay? So, for example, when we say crossover, that's when the pressure between LV and aorta nagkakaroon ng difference. So, when the pressure in the LV is higher than the aorta, the aortic valve will open because the pressure in the LV will push the valve to open. And that's the crossover out here. Meron ding crossover dito. When the pressure in the aorta is now higher than the pressure in the LV, it will push the aortic valve to close. Okay? So yun yung nag-open and close ng valve. There is no mechanical opening. There is no papillary muscle that will pull the valve to open or close, something like that. The valve opens by pressure difference. So that's the crossover. Meron ka lang tinatawag ditong incisura, yung parang hump dito na konti before it declines diretso pababa. I mean, before it declines to approximately 80, ganun. Yung incisura na yun is because of the aortic valve closure. Common question yan sa, hindi siguro sa exam nyo, but sa exam in residency training or cardiology training. So this is Wigger cycle. Dapat daw memorize nito by heart kasi ito yung hemodynamics ng cardiology. Okay. The total blood volume is 5 liters. Kailangan nyo yung maintindihan na 5 liters lang yung dugo natin. So for example, sinaksak ka tapos nag-blood loss ka ng 2 liters, 3 liters na lang yung dugo mo, nakakaloka yun. Kaya nakakamatay pag mag-blood loss ka ng more than 1 liter because you cannot produce blood in an hour. It will take like a day to produce new blood. So 5 liters lang. Now, in that 5 liters, 84% is in the systemic circulation and 16% is in the pulmonary circulation and in the heart. So sa 16% na yon, 9% is in the pulmonary circulation, 7% in the heart. So kung titingnan nyo, konti lang talaga yung blood na nasa loob ng heart. So of the 5 liters, 7% lang yung nasa heart. Pinakamaraming blood is in here, in the veins, venules, and venous sinuses, about 64%. Kaya nga tinatawag silang capacitance vessels. Later, we will talk about bakit sila merong capacity to contain blood. Okay? 13% is in the arteries. Less than 15% is in the arteries and arterioles. And They are known as the resistance vessels because they have the capability to like vasoconstrict to the point na zero ang blood flow, or they can dilate 2 to 3 times their size and it can increase the blood flow. Ganun. Yung capillaries is about less than 5%. It is known as the exchange vessels. Dito yung merong kang diffusion of electrolytes, nutrients, and exchange of water, something like that. So, exchange vessels yung capillaries. Okay, so let's compare the size and the cross-sectional area and the pressure. So the highest pressure is in the aorta kasi malapit siya sa LV, and it's the LV that generates the pressure. When the LV contracts, it will generate pressure. So pinakamalapit is the aorta. And the lowest is in the vena cava kasi yung vena cava, 0. The normal pressure there is 0 to 5. Pag 0 yung pressure sa inferior vena cava, mas gusto natin yun. Because blood flow from higher pressure to lower pressure. So, kailangan may difference yon. So, aorta is like 100, sabihin natin 100 or 120 millimeters mercury, tas 0 sa vena cava. Kaya, the blood will flow from aorta back to the inferior vena cava. So, because of this pressure difference, kaya na ibabalik yung whatever blood that goes out into LV will go back to the right atrium because of this pressure difference. And having said that, if the pressure in the inferior vena cava will rise, let's say it's 8 millimeters mercury, hindi siya makaka-drain, and that's the reason why there will be peripheral edema. I hope na intindihan niyo yan. Kasi pag mataas yung pressure sa inferior vena cava, di siya makakapag-drain. So, blood will backflow, it will go to the interstitial space, and then there will be edema. Okay? So, you have to take note in the graph. Kailangan magaling kang tumingin sa graph as a student kasi sa exam, yung teacher mo will take most of the questions on the graph. So, tingnan mo, the highest pressure is in the aorta, the lowest pressure is in the vena cava, but the biggest drop of pressure is in here, in the arterioles. Okay, that's the biggest drop of pressure. So sa capillaries, it's like about 20 to 40 millimeters mercury yung pressure. Mababa lang siya. So let us look at the cross-sectional area. The aorta is, kung tutusin, malaking artery siya. But in terms of cross-sectional area, siya yung pinakamaliit. Kasi ang dami-daming arterioles, ang dami-daming capillaries, to the point that the largest cross-sectional area are the capillaries, combined lahat ng capillaries. Siya yung pinakamalawak. Okay? So aorta has the smallest cross-sectional area, about 2.5 centimeters squared, but it has the highest pressure. So among all the veins, okay, it has the smallest, yung inferior vena cava has the smallest cross-sectional area, and it has the lowest pressure among all the circulatory tree kasi 0 to 5 millimeters mercury yan. Yung capillaries has the largest cross-sectional area, 2,500 centimeters squared. Pero compared sa aorta, mga 20 to 40 millimeters mercury siya, no? So, kailangan alam nyo to. Yung relationship to the cross-sectional area and the pressure. So, this is about the flow velocity. So, because the aorta, the flow velocity is lowest in the capillaries because of its wide cross-sectional area. Madidissipate kasi yung velocity. So, later, we will talk about ano ba yung physics behind this. Bakit bumababa yung... Okay naman yung signal. Okay. The velocity decreases if the cross-sectional area increases. So, kaya sa capillary, mababa yung flow velocity. And this is actually physiologic because you want diffusion in the capillaries. Mahirap kung mataas ang pressure in the capillaries kasi hindi makaka-diffuse. So, the pressure and the velocity in the capillaries is low, and that's why the flow is also slow, about 2 to 3 seconds yung flow in the capillaries. This is enough for diffusion of nutrients, water, and electrolytes. Unlike sa aorta, sobrang maliit yung smallest yung diameter niya, ang taas ng velocity, and the flow is also fast. Okay, so there is this relationship. The higher the cross-sectional area, the lower the flow velocity, or the slowest the flow. Okay. Okay, so flow in the large arteries is pulsatile because if the aortic valve is open during systole, isang unit, isang continuum na si LV and the aorta. And that's why tataas yung pressure sa aorta kasi nga, di ba, nag-degenerate si LV. When the LV contract, it will generate pressure. And so the pressure in the aorta will be parang consistent. Kung tataas ang pressure sa LV, tataas din yung pressure sa aorta. But pag relax ni LV, up to, let's say, 80 millimeters mercury. So, kaya nagiging pulsatile yung BP mo, ay yung pressure. Nagiging may systole ka, may diastole. So, when you get a blood pressure in the arm, there will be systole and diastole. So, pulsation disappears as blood flows through the capillary and more distal vessels because of the drop of pressure, the drop in pressure in the arterioles. Pagdating sa capillaries, halos wala na siyang pulsation. Kaya, ang hirap-hirap naman no, kung hawakan mo yung nails mo tapos nagpo-pulsate siya. Nakakaloka yun. Wala nang pulsation sa capillaries. It's on the arterioles. Okay? Arteries, medium-sized arteries. So the mean arterial pressure is about 100 millimeters mercury. So the normal mean arterial pressure is 60. In the book, some books says 60 to 100, pero akong ginagamit ko is 70 to 100 millimeters mercury. In our cardio book, it's 70 to 100. And I like the 70 to 100 because 7 is my lucky number. Okay? So the pressure in the right atrium is 0 to 5, but we want it 0. Kasi the lower the pressure in the aorta, mas yung pressure difference, mas maganda yung flow from LV back to the aorta, to the right atrium. So we want the pressure in the right atrium to be 0. Okay. So arteries, sa book nyo, it says it's defined as it delivers oxygenated blood to the tissues. Alam nyo namang there is an exemption to the rule. Kasi yung pulmonary artery carries deoxygenated blood. Okay? So the proper term or definition of arteries, dapat it carries blood away from the heart, while veins carries blood towards or back to the heart. Okay? So, ganun siya dapat. But anyway, arteries, most of the time, delivers oxygenated blood. It has a thick wall. And it has an extensive elastic tissue and smooth muscle because this has to work on a higher pressure. And blood volume contained in arteries is called the stress volume. Arterioles are smaller branches of the arteries, and this is the site of the highest resistance in the cardiovascular system because, again, it has a smooth muscle that can vasoconstrict to the point no zero yung blood flow into the tissues, or it can vasodilate to the point that about 2 to 3 times increase in blood flow. So, kaya siya yung resistance vessels. So, it is regulated by autonomic nervous system. We will discuss this further in the next chapter. Sympathetic activity will vasoconstrict these arteries via the alpha adrenergic and beta adrenergic receptors. And sympathetic activity will vasodilate this. Vasoconstrict pang sabi ko. Vasodilate these arterioles. Parasympathetic will vasodilate and sympathetic will vasoconstrict the arterioles. Capillaries has the largest cross-sectional area, surface area, and it consists of a single layer of endothelial cells, and then it has thin wall, and this is the site of exchange of nutrients, water, and gases. Kaya siya tinatawag na exchange vessel. Okay, venules, merge of capillaries, and veins has the highest proportion of blood in the cardiovascular system. It can contain as much as like 3.5 to 4 liters of blood. So sobrang yung 5 liters na volume mo, minsan yung 2.5 to 3 liters no, nasa veins. Kaya siya tinatawag na venous capacitance. Capacitance vessels. So there are alpha adrenergic receptors there. It can vasoconstrict as well and vasodilate this vein. So vasoconstrict meaning the blood will be delivered back into the right atrium. So if you have blood loss, there is enough blood pa naman, a little bit of blood in the veins that can be returned back into the atrium. And when you have volume overload in the lungs, pag nagpo-congest yung pasyente, these veins can vasodilate and somehow contain the blood in the veins to decrease the venous return to somehow parang alleviate the congestion. So they are highest proportion of blood in the veins. Okay. This is the basic principle of the circulatory system. Blood flow to most tissues is controlled according to the tissue need. So, 5 liters lang kasi yung dugo natin. For example, nakaupo ka, mataas yung circulation sa gastrointestinal system. Pero pag bigla kang tumakbo, the heart, the brain, and the muscles in the lower extremities needs more blood. Okay? So, magvasodilate yung arteries into the gastrocnemius, into the coronary arteries, yung cerebral arteries will vasodilate to increase blood flow. While the arteries in the gastrointestinal tract has to vasoconstrict para yung blood will be delivered to the tissues that needs blood supply. So meron tayong tinatawag na auto-regulation. Okay? So cardiac output is the sum of all the local tissue flow. So yung 5 liters na cardiac output mo, it's because of all the blood flow from head to toe. So kung for example, operahan ka above knee amputation, natanggal yung paa, bababa din yung cardiac output mo kasi nabawasan ko ng tissue. So every time you remove a limb, bumababa din yung cardiac output. Okay? Arterial pressure regulation is independent of local blood flow and cardiac output. So kailangan nyo itong maintindihan kasi kung hindi pwedeng pag tumaas yung arterial pressure, tataas din ang cardiac output. Hindi pwedeng bababa yung arterial pressure, bababa din yung cardiac output. Pwede naman silang sabay, but hindi pwedeng all the time sabay sila. Kasi for example, nag-heart attack si pasyente, buong LV affected. So hindi na siya nagko-contract. What will happen is the cardiac output will decrease. So dapat yung blood pressure hindi rin babagsak, otherwise mamamatay yung pasyente. So there are a lot of mechanisms to keep the blood pressure up para buhay pa rin yung pasyente, like an increase in sympathetic activity that will increase the total peripheral resistance, vasoconstrict the vessels, and to somehow maintain the blood pressure. Okay? So hindi sila magkaiba sila. Hindi pwedeng bababa ang blood pressure, baba din ang cardiac output. Pwede naman yun. But they are independent to one another. Again, if the cardiac output drops, the blood pressure should rise to keep you alive. Kung sobrang taas naman ng blood pressure, hindi naman pwedeng mataas palaging cardiac output. So somehow ilo-lower din yung cardiac output. So this is now the basic understanding that the formula of blood pressure is cardiac output times total peripheral resistance. So an increase in cardiac output will increase the blood pressure. An increase in total peripheral resistance will increase the blood pressure. So if there is a drop in cardiac output, the total peripheral resistance has to increase to keep the BP maintained, to maintain the BP. Or if the vessels vasodilate, so the total peripheral resistance decline, the cardiac output has to somehow increase to maintain the blood pressure. So arterial pressure is independent of cardiac output control. Okay, dito na yung physics. This is volume flow rate. This is basic physics. So velocity is directly proportional to flow, meaning to say, wait lang po, may tumatawag. Naririnig niyo pa ako?
Yes po, Doc.
Okay naman yung
Yes po, Doc.
Natatakot ako kung biglang ma-out. Ayan mo sila. So, volume flow rate, the velocity is directly proportional to flow, meaning the higher the pasensya na kayo. Volume flow rate states that velocity is directly proportional to flow, meaning the higher the velocity, the higher the flow. And it is inversely proportional to cross-sectional area. So sa physics, pag meron tayong tube, meron tayong pipe, and then may dumadaloy na dugo. So for example, sa V&G, in the morning, mahina yung daloy ng dugo kasi ang baba ng pressure. But if you use a water pump, tataas yung pressure kaya malakas na rin yung flow. Ganun siya. So increasing the velocity will also increase the flow. Pero this is inversely proportional to cross-sectional area. So if you have a tube and then yung i-close mo yung thumb mo, yung tip, because you decrease the cross-sectional area, the pressure will rise. And then pag tanggalin mo yung thumb, nag-increase yung surface area, yung flow will be yung pressure will decrease. So increasing the cross-sectional area will decline the velocity, while uh, decreasing or constricting the vessel or decreasing the size, the cross-sectional area, will also increase the velocity. So this is basic understanding na blood velocity is higher in the aorta kasi di ba aorta is the smallest diameter, it's about 2.5 centimeters squared. So a centimeter, so centimeters squared in cross-sectional area. It has the smallest diameter. That's why it has also the highest velocity and flow. Whereas the capillaries has a very large cross-sectional area, kaya yung velocity and flow bumababa. Yun, yung understanding na yun. So this is volume flow rate. Again, ulit lang, velocity is directly proportional to flow. The higher the velocity, the better the flow. And velocity is indirectly proportional to cross-sectional area, meaning to say, if you increase the cross-sectional area, the velocity will decrease, the flow will also decrease. Whereas if you decrease the cross-sectional area, the velocity will rise and the flow will also be better. Okay? Hi. Pahirap na ng pahirap, Diyos ko Lord. So kailangan yung first formula, maintindihan nyo yung volume flow rate. Because we will put all together all this formula. Kasi sa cardiovascular physiology, hindi lang naman isang formula ang gagamitin mo. So we will put it all together. This is Ohm's law. And it states that the flow of blood is directly proportional to pressure gradient, meaning if the pressure gradient is high, the flow is also better, but it is inversely proportional to resistance. By increasing the resistance, you decrease the flow. So if you vasoconstrict a vessel, you increase the resistance, kaya yung flow noon, hindi makapasok yung dugo, kaya nababawasan. And this, para siyang opposite sa kanina, di ba? Sa volume flow rate. Sabi kanina, you have increased the cross-sectional area, decrease yung velocity. So it's about velocity na. But somehow the flow will also be affected. Pero this is another formula that you have to put it all together later. So in Ohm's law, it states that the flow is inversely proportional to resistance. If you increase resistance by vasoconstricting the vessels, for example, totally lumen is 0, walang flow yon. So increasing the resistance will decrease the flow. That's the basic understanding of Ohm's law. So the pressure gradient drives blood flow. Palagi ko yung sinasabi, blood is flowing in our vessels because of a pressure difference. If there is no pressure difference, walang flow. Okay? Kung parehas ang pressure ng aorta at saka ng vein, walang flow ng inferior vena cava. Patay si pasyente. So, kailangan napakataas ng pressure difference noon. 120 ang pressure ng aorta mo, 0 ang pressure ng inferior vena cava, and that's why there is this constant flow in the vessels. Okay? The blood flows from higher pressure to lower pressure. And this is the reason why nagkakaroon ka ng edema. Kung tumataas ang right atrial pressure to, let's say, 8 to 10 millimeters mercury, mag-iedema ka because you have decreased the pressure difference. And blood flow is inversely proportional to resistance of the blood vessels. If you vasoconstrict all the arterioles, the blood flow into that tissue will be decreased. Sometimes nga walang blood flow to that tissue. Kaya pag magbigay ka, for example, ng dopamine or norepinephrine in a maximum dose, mapapansin mo yung mga kamay nun, mangingitim-ngitim na yon kasi it's vasoconstricted yung mga arterioles nun, and then wala ka ng blood supply sa extremities, peripheral extremities, kaya nangingitim sila. So, because of increasing the resistance in the blood vessels, the flow is also affected. Okay. Kailangan memorize nyo na yon, yung volume flow rate, naiintindihan nyo na, pati yung Ohm's law, naiintindihan nyo rin. Kasi yung next na law, Diyos ko Lord, pahirap pa ng pahirap. This is, hindi ko alam kung paano to i-pronounce, Poiseuille's law. Bahala kayo kung German kayo or French, Poiseuille equation. So, before we talk about resistance, kasi yung resistance, kinuha siya sa equation ni Poiseuille's equation. So, ito yung Poiseuille's, parang gusto kong Poiseuille lang. Pero silent L daw, Poiseuille law. Okay. So, flow is directly proportional to pressure gradient and radius to the fourth power. Meaning to say, maayos-ayos yung flow pag malaki yung surface, yung radius ng vessel, and then yung pressure gradient. But it is inversely proportional sa haba naman ng length ng vessel. Kasi, for example, meron kang 10 meters, same pressure gradient, but 10 meters yung length ng isang vessel. Yung second vessel has like 50 centimeter length. Mas mauunang tumulo yung tubig doon sa maliit yung length compared to mahaba ang length. So, flow is inversely proportional to length. And flow is also inversely proportional to viscosity. Because kung ipapadaloy mo sa isang tube yung water at saka ketchup, sinong unang tutulo? It will be water because ketchup is more viscous. So based on mathematical derivation, resistance is now directly proportional to viscosity, meaning the more viscous the volume of blood, the higher the resistance. And the longer the length, the higher the resistance. So, ganun lang siya. So, kanina we have talked about volume flow. We have talked about Ohm's law. We have talked about Poiseuille's law in terms of resistance. So, we will put it all together. Paano ang mga law na to nakaka-affect sa blood flow? Okay? So, sa lahat ng factor in resistance, it is radius that will greatly affect the resistance because it is to the fourth power kasi. So, ibig sabihin, if the radius decreases by factor of 2, the resistance increases by factor of 16. So, the higher kung tumaas ang radius, bababa si resistance. Pag lumiit si radius, tataas ang resistance. And this is exactly what happens in arterioles. If the arterioles vasoconstrict, then the resistance will increase. And if the arterioles increases in size, the resistance will decline. Okay? And that is also opposite to flow. Because if you vasoconstrict the vessels, the flow the resistance increases, but the flow also declines. And if you vasodilate the vessel, you decrease the resistance and the flow also increases. Di pala opposite, no? Same. Okay. So, This is about turbulence. Don't be confused. We have talked about resistance, and this is about turbulence. And we are using the Reynolds number. The higher the Reynolds number, the higher the turbulence. So look at the tube with a laminar flow. When we say laminar flow, that's the normal flow of blood. Because if you look at the lines of the flow of blood, it should be straight line and it should be parallel. And there's that parabolic shape at the onset, because yung center has a higher pressure, higher velocity, I mean, but the sides will have a decreased velocity because of the resistance to the wall. Kaya siya nagiging parabolic. Yung center medyo nauuna, yung nasa gilid ng wall will be a little bit delayed, but the lines are straight. Now, in a turbulent flow, nagkakaroon ka ng eddy currents. We call it eddy currents in physics, wherein paikot-ikot yung flow ng dugo, yung lines will be now curved and it will bump into the surface area, kaya tumataas yung velocity. And then yung resistance will be a little bit higher and it will cause turbulence. And then because of turbulence, yung pounding ng volume of blood into the vessel, yun yung maririnig mong mga bruit or murmur sa physical exam mo. And this is affected by velocity, by vessel diameter and density, and it is inversely proportional to viscosity. Doc, sabi mo kanina, viscosity increases resistance, and this is about turbulence. So, for example, meron kang container that has water, uga-ugain mo. Kesa sa container with ketchup, uga-ugain mo. Saan yung mas may turbulence? Di ba yung sa water? Kasi mas less viscous siya. So, turbulence is inversely proportional to viscosity because that's in Reynolds formula. That Reynolds formula is that turbulence is directly proportional to velocity, to diameter, and density, but it is inversely proportional to viscosity. So if we look at this, or if we use this in the vessels, yung Reynolds number is increased if there is a high velocity of blood flow, if there is that pulsatile nature of flow, and if there's a sudden change of vessel diameter. For example, malaking artery tas biglang liko, malaki ang turbulence noon. Biglang liko to a smaller diameter. Or pag malaki naman yung diameter ng isang vessel, for example, a vessel that has an aneurysm, di ba? Parang normal diameter, tapos biglang lumaki, magkaroon ka ng aneurysm, malaki din ang turbulence noon. So Reynolds, don't be confused. This is not about resistance only, but this is about the turbulence. So ibang formula yun. Okay. So capacitance naman, this is in our understanding to veins, that capacitance is directly proportional to volume but inversely proportional to pressure. So the more volume inside the vessel, magdadilate kasi yun, magdadilate yung vein, for example. So the capacitance also increases, but the pressure will decrease. And this is the reason why sa vein, it is able to contain enough or more blood volume, but a low pressure. See, aorta has a little bit of capacitance. It has to dilate a little bit para ma-contain niya yung too much or ang daming volume coming from LV without increasing too much the pressure. Parang madi-decrease niya somehow yung pressure. So, for example, the aorta is stiff. Hindi siya magdadilate. Ito yung pathophysiology behind isolated systolic hypertension. Kasi yung aorta will not dilate, therefore yung pressure will not be decreased. So, ang mangyayari, pag stiff si aorta, pag contract ni LV, pag open ni aortic valve, yung blood will go to the aorta. Dahil hindi nag-dilate sa aorta, tataas yung pressure during systole. Kaya yung mga elderly population with atherosclerotic aorta, they have this systolic hypertension. Parang mataas lang yung systole but the diastole is not affected. So that's the pathophysiology behind. If there is no capacitance, kung nawawala yung elasticity ng aorta. Okay, if the aorta is stiffer or less distensible. All right, so arterial pressure is pulsatile. And that's because of the systole and diastole, or contraction and relaxation of the LV. And that's the reason why when you take a blood pressure, there will be systole and diastole as well. So systole is the highest arterial pressure during the cardiac cycle, while diastole is the lowest pressure during a cardiac cycle. Don't be confused ha. Na nakukuha mo, wait lang na may tumatawag uli. Andyan pa ba kayo?
Yes, po, Doc.
Pasensya. Sabi ko sa inyo, toxic ako. May toxic akong patient sa ICU, sorry.
Doc, we cannot hear you po.
I'm sorry. So, pulse pressure. Ano bang sinabi ko din yung narinig, no? Kung maging intern ko na kayo or maging resident ko na kayo, tatanungin ko kayo about pulse pressure. Sana maalala nyo. Because this is important clinically. So, pulse pressure is the difference of the BP. So, if you get a blood pressure, meron kang systole, meron kang diastole. So, most of the time, it will be 120/80. 120 yung systole, 80 yung diastole. So, pag i-minus mo lang yung 120 minus 80, yun yung pulse pressure. So, in other books, it says 20 to 40 pulse pressure. Ako, ang ginagamit ko is 30 to 40. I will not ask you the normal value. Just know the formula of pulse pressure. And pulse pressure is you are looking at the stroke volume. So, if the pulse pressure is high, meaning maganda yung stroke volume. If the pulse pressure is low, meaning pangit yung stroke volume mo. And so, there are conditions that you will have understanding kung ang pulse pressure mataas or mababa, pero ngayon hindi nyo pa kailangang alamin yan. Just know that pulse pressure is the difference of systolic and diastolic pressure, and it's an important determinant of the of the stroke volume. Okay? So, for example, in atheromatoous aorta, di ba, hindi na sila elastic, and so tumataas yung systolic pressure, pero si diastole remains to be the same. Kaya yung pulse pressure will be increased. Kasi, for example, nagiging 180 na yung systolic pressure, pero 80 pa rin diastole. Kaya, pag i-minus mo yan, mataas na yung pulse pressure. Okay. Mean arterial pressure naman is you are considering one cardiac cycle. So the formula there is, ang mini-memorize ko is this formula. Kasi parang mahirap ko eh. Parang ito yung mini-memorize ko. So if your blood pressure is 120/80, you just add 120 plus 80 plus 80. So 1 systole and 2 diastole divided by 3, that's the mean arterial pressure, and it's the average arterial pressure with respect to time. Okay? Yes, I think this is the hindi pa. Sorry, excited lang. So venous pressure is very low. It has the highest capacitance. Alam na natin yung formula ng capacitance. It is directly proportional to volume of blood. The higher the volume, it will distend the vessel, so the capacitance will also increase. But it is inversely proportional to pressure, and that is why the pressure in the veins is low. So atrial pressure, if you put a catheter on the right atrium, you can measure the atrial pressure. You can also even measure the pressure in the left atrium. But you cannot put a catheter there. Ang gagawin mo lang is you put a pulmonary wedge pressure, you dilate the balloon, and then yung pressure nun is approximately the pressure in the lungs or pulmonary arterial pressure, which is also equivalent to pressure in the left atrium during systole. Okay, kasi magiging isang continuum lang sila. But to measure the pressure in the right atrium, we can just put a catheter in the right atrium and in the cath lab, maglagay ka ng catheter sa right atrium, ma-measure mo yan. Pero sa left atrium, alam mo namang tusukin mo yung left atrium. So, yes, we do that if we are doing some procedures, pero suffice to say, we just use the pulmonary wedge pressure. So, measured pulmonary capillary pressure is approximately equal to the left atrial pressure. So, yung atrial pressure, yun yung nakikita mong wave in a Wigger cycle. Meron kang A wave, C wave, and B wave. So, atrial pressure is approximately, the right atrial pressure is different from the left atrial pressure kasi slightly elevated ang pressure sa left atrium. The right atrial pressure is about 0 to 5 millimeters mercury, while the left atrial pressure is about, it should be less than 8 to 10 millimeters mercury. So, ganun lang yung difference. Yay! Ang hirap nun, Diyos ko Lord. Mas maganda siguro kung magtatanong kayo so I can assess kung alin doon yung hindi nyo naintindihan or kung alin yung naintindihan nyo. Sorry, nakamask ako. Kasi baka may katabi ditong may COVID. May tanong kayo? Boyle's Law? Ang taray. Cindy May. Magaling ka siguro sa ano, no? Sa physics. Boyle's Law pala yun? Hindi ko alam. Ang alam ko lang is the volume flow rate. So, Boyle's Law pala yun. Okay, thank you. Ano pa? Maikli lang siya sa chapter nyo. Sa clinical practice, ang mas nagagamit ko is the Possel's Law. Hi, Doc. Good morning. Can we go back to the formula for mean arterial pressure? So, mean arterial pressure is 1 systole plus 2 diastole divided by 3. For example, if the BP is 120 over 80, ang gagawin mo is, wait lang, magpo-compute ako. I need a calculator. So, it should be 120 plus 80 plus 80 kasi diastole. And then divided by 3, the mean arterial pressure is 93 millimeters mercury. So the normal mean arterial pressure is 70 to 100. Okay? Yung pulse pressure naman is i-minus mo si systole versus diastole. So if the BP is 120 over 80, so 120 minus 80, the pulse pressure is 40. So the normal pulse pressure is 30 to 40. Pag more 40, mataas na yung pulse pressure, meaning tumaas yung stroke volume. So ang pulse pressures, you are looking more of a stroke volume. But mean arterial pressure, you are looking the blood pressure as a whole. Pangit pang signal. Hello? May magtatanong? Kahilig, are you going to question or ask a question? No? Okay. Hi, Cindy! Pasels law. Ang hirap no, Diyos ko Lord. Yes.
Jose. Jose.
Jose. Silent L daw eh, kasi it's a French ata yan eh, French. Mm-hmm. You are correct. You are correct to that. Parang ginamit lang siya. By mathematical derivation, binaliktad lang nila na resistance is not directly proportional to viscosity and length. Meaning to say, the more viscous the vessel, the higher the resistance. Okay? So si ketchup at saka si tubig, ang resistance sa ketchup kaysa sa tubig. Okay? And then, pag mas mahaba yung length, mas mataas ang resistance kaysa sa maliit lang yung length. Kasi yung... Ay, taray. Thank you, Quasi. Social. So, yung blood kasi, habang dumadaloy siya, there is resistance to the vessel wall. So, the longer the vessel na tatravelan niya, may resistance yon. Kaya pababa ng pababa yung velocity at saka yung pressure. Kaya may factor yon kung bakit 120 millimeters mercury si aorta. Pagdating sa vein, halos pa zero na siya. Kasi yung dinaanan niya super layo, no? And habang palayo ng palayo, pababa ng pababa yung velocity because of the resistance to the vessel wall. Yun. And another understanding there is that if you vasoconstrict the vessel, the resistance will increase. And that is the reason why if there is a blood loss, gimbuno ka ba? Tapos about 2 liters yung blood volume na nawala. The arterioles, by sympathetic activity, has to vasoconstrict. And when all the arterioles are vasoconstricted, the total peripheral resistance will increase. And because of increase in total peripheral resistance, the blood pressure will increase. Yun yung importance niya. Hindi mo siya gagamitin yung formula in each vessel because you have to gather all the formula as a whole and doon mo siya magagamit. Hindi pwedeng gagamitin mo siya ngayon lang sa isang pangyayari. For example, vinasoconstrict mo sa vessel, ini-expect mo bang, for example, the one arterial is vasoconstricted, what will happen to the flow there? Will it increase or will it decrease? It will decrease because walang makakadaloy na dugo. And yung example nun, na maganda, pag tumakbo ka, yung arterioles in the gastrointestinal system will be vasoconstricted, and it will decrease the blood flow into the gastrointestinal system, while the arteries in the gastrocnemius is vasodilated, and it will cause increased blood flow to the gastrocnemius because you need blood flow into the gastrocnemius. Kaya magkaiba sila, no? Hindi pare-parehas. Ano pa yung tanong nyo? Huwag kayong mahiya magtanong.
Dok, kung maganda calculation ha exam, ano?
Wala. Don't worry. Gusto mo bang pa-computing kita ng mean arterial pressure? Para hindi mo pa magagamit yun. But
Wag na, Dok.
Use that, oo. If I have a patient na nagre-refer sa akin yung resident, doc, the blood pressure is ganito. Ayoko yung you just look at the BP as systole and diastole. Let's say 120/40. Huwag kang ganun lang. Titingin ka lang, okay naman, 120/40. Ito, story pala. This is true to life story. Yung training officer ko during fellowship training cardiology, nag-rounds kami sa isang pasyenteng septic na refer sa cardiology because mababa yung BP. The pressure of the patient is 90/40. Sabi ng ng training officer ko, Ryan, look at the BP. Look, medyo okay naman na, doc, kasi kanina, mas mababa pa yun eh. But now, because of the inotropes, we are at like 90/40. I'm okay with that. Sabi niya, no, you have to look at the BP in a further detail. Like looking at the BP, not just systole and diastole, but looking at the pulse pressure as well as the mean arterial pressure. So, in 90 minus 40, makapag-compute na. Ilan ang pulse pressure nun? 90 minus 40. 50 ng pulse pressure. So, consistent siya. One of the differential diagnoses of wide pulse pressure, meaning more than 40 millimeters mercury, is sepsis. So, alam niyo yun, it will help you analyze na, septic nga talaga yung pasyente kasi wide yung pulse pressure. So, during the board exam, nagbo-board exam ako ng cardio, nandun yung question, which of the following will cause a wide pulse pressure? Walang except. One of the choices is sepsis. Di na ako nag-isip. Sepsis na agad-agad ang sinagot ko. Tumatayo yung balahibo ko habang nag-i-exam. Di ba masaya? Nag-gets niyo ba yun?
Yes, Doc. Ano yan na naging why is it that
Pulse pressure?
yes, naging kuan siya reason is sepsis?
Because the pathophysiology of sepsis is a generalized vasodilation of the arterioles. Mababasa nyo yan. And that's why in septic patients, pag mag-hypotension sila, we give inotropes, norepinephrine, dopamine to vasoconstrict the vessels. Bakit nag-vasodilate? Ang hirap nang sagutin yun because in sepsis, you release a lot of hormones and substances that vasodilates the vessel. Kaya there is generalized vasodilation and the blood pressure drops. And so the treatment is to give inotropes, norepinephrine or dopamine to vasoconstrict the vessels. So somehow the blood pressure will rise.
So actually, pwede Trendelenburg position ang pasyente, Doc, kung sa general sepsis?
I mean, it can just temporize. As a nurse, yun yung gagawin mo. Kung nag-exam ka sa nursing, kung yung nag-exam, nursing board exam, ang isasagot mo is leg racing, hindi dopamine kasi hindi ka doktor. Pero ngayon na nagdo-doktor na kayo, ang isasagot nyo is you give inotropes, you give vasoconstrictor because the pathophysiology of sepsis is vasodilation. In terms of hypotension,
Thank you, Doc.
the normal pulse pressure is 30 to 40. Yes. Sa ibang book, it's 20 to 40. I think, mababasa nyo yan, malalaman nyo yan, paiba-iba yung iba eh. But in Braunwald, it's 30 to 40. In Harrison, it's 20 to 40. So when I was in residency, 20 to 40. So nagka-cardio na ako, 30 to 40. So ngayon, ang ginagamit ko is 30 to 40. Meaning more than 40 is wide and less than 30 is narrow pulse pressure. Mabasa nga ang Boyle's Law, no? Hindi ko alam yung Boyle's Law na yan. Ang hirap ng physics kaya, muntik-muntik lang akong bumagsak nun. Diyos ko. Tapos ngayon, physics ang pinag-aaralan natin. Kaya nga ako nag-doktor dahil ayaw ko ng physics and mathematics. Tapos marami din pala, no? Hindi pa nga tayo pumupunta sa Laplace Law. May stroke pa kayo nun. Kailangan yung alam yung mga law, kahit anong gawin nyo, lalabas siya sa exam. Wala tayong choice, student kasi kayo eh. So, ako after this lecture, kakalimutan ko na siya. Pero kayo kailangan memorize niyo. Lalo na yung magbo-board exam, no? Lumalabas to sa board exam eh, yung basic law. Siguro yung lalabas yun is Possessed Law kasi sikat siya eh. May tanong pa kayo? Huwag kayong mahihiya ha.
Doc, question lang ba?
Yes.
What other laws of physics should we try to review?
Ang libro kasi natin is Guyton, so halos yun lang ang mga law na nilagay niya sa chapter niya. Wala nang iba. Tsaka ayaw ko na rin kumuha ng physics. Diyos ko, Lord, ayaw ko nang kunin yun. No? Ayaw ko na magpanggap. Ito pa nga lang na mga law na na diniscuss ni Gayton, ang hirap-hirap na nun. Merong iba sa inyo siguro ang tali-talino, ang dali-dali lang ma-memorize. Pero yung iba sa inyo, pare-parehas lang tayo nahihirapan. Kaya muna tayong magdagdag kung anong
Thank you, Doc.
if you read the book, yun na yun. Yun na yun. Yung mga law na yan. Gusto ko pa nga sanang magtanggal. Kaso lang, makikita nyo rin pag open nyo ng libro. Kita nyo rin siya. When you read the book, siguro naman you can have enlightenment with how I discussed it. So somehow matutulungan kayo nun. Kung hindi man kayo natulungan, hindi kayo niya. Basahin nyo yung book. Andun din naman siya. Hi, Cindy! Yes. Oo. Mm. Mm. Emotional. Right. Tama. Alam mo, ang mahirap dyan sa exam, yung nag-a-analyze ka na, kunwari, memorize mo yung formula, tapos nag-a-analyze ka na, ang hirap-hirap talaga siya, na-stroke ako yung pag nag-i-exam ako. Kaya, memorize niyo yung formula, and then ipa-practice niyo na siya, isusulat niyo na siya sa paper niyo, yung mga directly proportional at saka inversely proportional, para hindi na kayo mahirapan. Tapos yung minsan nakakatulong yung mga examples in terms of the viscosity. Kasi minsan pagdalating sa exam, pag wala kang example, mahihirapan ka. For example, yung ketchup at saka tubig, alin bang mas mataas ang viscosity?
Ketchup.
O sino ang mas madali ang flow? Ketchup or tubig?
Tubig, Doc.
Right. So in terms of resistance, dahil mataas ang viscosity, pag mataas ang viscosity, mas decreased ang flow. In terms of vessel wall, for example, not pressure ha, we're talking about flow. Sino ang mas maganda ang flow? Yung maliit yung vessel wall or yung malaki yung vessel wall?
Maliit yung vessel wall, Doc.
Ang mas mataas ang flow, mas maganda ang flow?
Yes,
For
po, Doc.
example, vasoconstricted versus vasodilated.
Ay, dilated, sorry.
Right. You have to think properly. Baka kasi yung iniisip mo yung isang formula eh. Kasi, di ba, meron tayong different formula but you use it in different physiology, different. Kasi hindi kasi hard and fast rules sa katawan eh. Meron mga exemptions kaya mahirap na siya. So, the greater the vessel wall, the cross-sectional area, the better the flow, the lower the pag vasoconstricted yung vessel, the lower the flow.
The question, Doc, ang cross-sectional area, Doc, is unsized lumen or unsized wall?
No, this is taking into consideration all, not just one. And that's why if you look at the size of the lumen of a capillary, mas malaki si aorta. But if you consider all capillaries, the cross-sectional area is sobrang laki ng capillaries. Kaya huwag kang mako-confuse. If you vasoconstrict the capillaries, walang flow. If you vasodilate the capillaries, maraming flow. Pero in a normal physiology na walang vasoconstriction and vasodilation, mas maganda ang flow, mas mahaba ang flow sa capillaries than sa aorta. Kasi sa aorta, dahil maliit yung diameter niya, mabilis yon. Ang taas ng velocity, ang bilis ng flow, like less than 0.02 seconds. Parang sobrang bilis lang. Agad-agad nakadaloy na sa kanya dahil maliit yung diameter niya. Sa capillaries, because of its wide cross-sectional area, the flow is slower, the velocity is slower. Kaya 2 to 3 seconds ang flow sa capillaries. Medyo matagal-tagal. And you need this matagal-tagal na flow ng blood sa capillaries because you want time for the nutrients to diffuse. Nagets mo ba 'yon?
Medyo, Doc. Confirm ko lang, Doc. So, cross-sectional diameter hit capillaries is nga tanang capillaries gintampo-tampo.
Yes. That's cross-sectional area.
Tapos gintunga hiya to half. Tapos tama ba? Aniya section, cross-sectional ba? Ang pag-cut it view.
Hindi siya ganun ang formula niya. Kasi centimeter squared yun eh. Parang, paano ba? Centimeter squared. So you measure one diameter and the other kunwari ito yung, nakikita nyo ba ako, hindi mo siya i-measure from one end to the other. Hindi yun eh. Kasi ang makukuha mo lang yun is centimeter. Ang cross-sectional area is, you measure from here up to the other yung buong circle. Kaya siya centimeter squared.
Okay,
Di
Doc.
kapag drawing eh. Can you see me? The below? Can you see me?
Yes, Doc, yes.
Measure from this area to the other area. That's just one line. And that is in centimeter. Ang cross-sectional area is yung from here dito. Kaya siya centimeter squared ang unit ng cross-sectional area. And then ipag-a-add mo lahat ng cross-sectional area ng capillaries, kaya sobrang taas ng cross-sectional area niya. Unlike in aorta, dahil isa lang siya. Although the lumen of the aorta is bigger than the lumen of the capillaries, but because there are a lot of... So if you're talking about diameter of the lumen, mas malaki si aorta, mas maliit si capillaries. But if we're talking about cross-sectional area, which is in centimeter square, ano siya, ang dami-dami kasi ng capillaries eh, kaya the velocity and the flow will be slower in the capillaries as compared to the aorta. And this is physiologic because you want the flow and the velocity in the capillaries to be slower because you want time for the electrolytes, the nutrients, and the water to diffuse back and forth. Parang ganun. Di ba? Parang may naiintindihan din kayo during questions, no? Pag hindi ka makapag-further ang tali-talino mo, kaya naintindihan mo na. Or hindi mo naintindihan, just ko Lord, dalawa lang yun. So if there is something hindi mo naintindihan, you can either text me or you can just read yung sa Guyton. Pero alam ko, nang binasa ko sa Guyton, parang ang hirap-hirap siyang maintindihan. When I was a student, I was reading that chapter, di ko rin siya naintindihan. Pero syempre ngayon na consultant na ako because of the many experience from residency to nadagdagan na siya na nadagdagan. And then, nakikita mo na somehow yung the whole, yung hindi lang isang formula, but all the formula, putting it all together, and somehow it helps.
Hello, Doc. Hello.
Hi, Bo.
Ay, may question lang po ako, Doc. Curious lang, like, paano po, Doc, kunin yung mean arterial pressure sa yung disease na co-artition of the aorta? Di ba yun ba yung disease, Doc, na upper extremity, higher pressure, tas lower extremities, yung lower pressure?
Okay. Yung mean arterial pressure, pag kumukuha tayo ng mean arterial pressure, you are looking at many parameters. The stroke volume, the heart rate, that's equivalent to cardiac output times the total peripheral resistance. So that's the mean arterial pressure in one cardiac cycle. So if you have a BP of 120 over 80, the mean arterial pressure again is 120 plus 80 plus 80 and divided by 3, that's the mean arterial pressure. Meaning to say, you are looking at the value of the blood pressure in one cardiac cycle. Looking at the systole and diastole, and looking at the cardiac output at the total peripheral resistance. Kaya maraming factors si mean arterial pressure. Now, you talk about coarctation of aorta. If you have a coarctation of aorta, after the takeoff This is common. After the take-off of the left subclavian artery, there is constriction there. And that's why the blood pressure in the lower extremity is low and the blood pressure in the upper extremity is high. Or magkaiba sila. So if you get the BP, let's say it will be, the BP in the upper extremity will be like 140 or 80. Pero sa lower extremity, halos, ano na siya, like 80, 40. Magkaiba sila. So if there's a pressure difference of 20 millimeters mercury in the upper extremity and lower extremity, that's abnormal. And you think of coarctation of aorta. So magkakaiba ang mean arterial pressure in the lower extremity and mean arterial pressure in the upper extremity. So it will somehow help you that something is going on in between. It's either you have a constriction below the subclavian artery or in the aorta or in the iliac arteries. Ang daming factors nun. Kasi mean arterial pressure lang ang kinuha mo eh. So that's why you will work up the patient. You need a CT scan, you need an echo, you need an MRI, something like that. So you cannot say na, constrictive coarctation of aorta to, hindi. So, yung mean arterial pressure is not a good way to diagnose coarctation of aorta. You just have to get the BP in the upper extremity and lower extremity. If there's a difference of more than 20 millimeters mercury in systole, then you consider coarctation of aorta. If you get the mean arterial pressure, you are just looking at, ano ba, kunwari ang mean arterial pressure ng isang pasyente is 40. Ang baba nun. Ibig sabihin, in your mind, you are thinking that somehow the cardiac output is decreased or the total peripheral resistance is decreased, the stroke volume is decreased, the heart rate is probably decreased. Andun ang cause nun. Kasi mean arterial BP is equivalent to cardiac output times total peripheral resistance and cardiac output is equivalent to stroke volume times heart rate. So maghahanap ka ngayon saan ang nakakakos ng mababang mean arterial pressure. Did I enlighten you?
Thank you for that. Opo.
Okay. Yung pulse pressure naman is the difference between systole and diastole and it's helping you about stroke volume. Hindi mo dun makikita yung, you cannot analyze there the total peripheral resistance. It's more of looking at the stroke volume. Pag mataas ang pulse pressure mo, mataas ang stroke volume. Pag mababa ang pulse pressure, mababa ang stroke volume. Parang nakakatulong lang siya when you analyze. Nakakatulong lang siya. Pero you need other diagnostics. But on physical exam, at least nandun kasi makukuha mo kasi yung BP. So 120/18, then you can analyze for pulse pressure, you can analyze for mean arterial pressure. I like the question.
Thank you for that.
Anong ka-pronounce ng name mo? Bonnie or Bone?
Bonnie po, Doc. Yes
Bone.
po.
Nako, Bonnie. Kaano-anong si Dr. Yao?
Kilala ko lang po, Doc.
Dapat makikipag-family ka. Okay. I like questions, really. Wala na? Wala na magtatanong. Naintindihan niyo ba yon? Or na-stroke kayo? Medyo mahirap-hirap din naman yung cardio in a way, pero kung pag-aaralan niyo, maiintindihan niyo rin naman siya. And the exam is fair din naman. Hindi ko rin naman kayo papahirapan. Kaso lang kailangan mag-aral na kayo ngayon because, Diyos ko Lord, isang exam lang tayo second bi-monthly na kaagad. So lahat ng pinagdidiscuss natin, isang bagsakan na yun lahat. So you are not college students anymore. You are not high school student anymore. Medical students na kayo. And lecture, and then mag-aaral talaga kayo. Kasi kung doon kayo mag-aaral sa bi-monthly, Diyos ko dahil sabay-sabay yan lahat ng exam. May stroke ka niyan. May question pa? Wala na? Okay. Kung wala na, thank you very much for listening. I hope nakatulong ako sa inyo today.
Thank
Bye-bye.
you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
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 Thank you,
Doc.
Doc.
Thank you.